Victorians are on edge this morning, waiting on the latest COVID numbers, which could dictate whether the state is plunged into further restrictions as the list of exposure sites balloons. Health alerts have been issued for almost 80 exposure sites, stretching across the city and into regional Victoria. They're including shops and workplaces, cafes, gyms, and most worryingly, a series of bars along the Chapel Street nightclub strip.
A second AFL match has been added overnight, with fans who attended the Essendon-North Melbourne game on Sunday now being contacted. And the alert has now spread across the New South Wales border, with members of a sporting club in the border town of Tulibuck exposed to a positive case on Saturday. Let's go straight to Leanne Wong in Melbourne. Leanne, good morning. So what's the latest?
Good morning, Michael. Well, the cluster in Melbourne's north now sits at 15 after the state recorded another 6 coronavirus cases yesterday. Authorities say the number of primary close contacts now is also in the hundreds. And concerningly, this list of public exposure sites just keeps growing. We're now sitting at almost 80 sites, including here at Marvel Stadium, which, as you mentioned earlier, authorities confirmed last night that one of the positive COVID cases had attended the Essendon North Melbourne match here on Sunday, along with more than 30,000 other spectators. It's also the second, concerningly, AFL match to be added to this list of public exposure sites, the other being the Pies versus Port Adelaide match, also on Sunday at the MCG. Now, just to give you an idea of just the spread of this number of public exposure sites, well, the sites are ranging from places in Melbourne's inner suburbs, so places such as South Yarra, Paran and Brunswick, all the way up to regional Victoria, so in places such as Axdale and Bendigo. And it's certainly worth taking a look at the Victorian Government's Health Department's website for those specific dates and times, just to keep across this number of sites. And it's expected that this list will be added to in the coming days. Now, there is one bit of good news, which is the fact that these 15 cases in this cluster so far are linked to each other. There are currently no mystery cases, which is particularly good news if we are hoping, fingers crossed, to avoid any potential lockdown. Let's take a listen to what Victoria's Chief Health Officer Brett Sutton had to say yesterday.
The only missing link is the link to the rollout case from South Australian hotel quarantine. All other cases, all of our 15 cases in this cluster are linked. So we understand the relationships between all of them. We've got an explanation for how transmission has occurred.
Brett Sutton. Leanne, there's also been a noticeable increase in the number of Victorians lining up for their COVID vaccinations too. So one brief upside from all of this.
Yeah, some pretty big numbers there. So on Tuesday, almost 16,000 Victorians got the jab. And just for context, that's more than double the number of Victorians who have been vaccinated in the previous fortnight, that daily average. So on average, we were previously seeing about 7,500 Victorians getting vaccinated. That's, as I mentioned, now almost 16,000 on Tuesday, which suggests that this latest cluster may have been a bit of a wake-up call for Victorians to get the vaccine, particularly if they were feeling particularly hesitant previously. Now, to help out Victoria's vaccine as well as fight this current outbreak, the Commonwealth has pledged to deliver an extra 130,000 doses of the AstraZeneca vaccine. That's including 40,000 doses just this week alone. They've also promised to provide more doses to aged care facilities here in Victoria that still have yet to receive a single dose. However, Brett Sutton yesterday made the point to was really actually quite emphatic that supply of the vaccine isn't actually the problem right now. The main issue that authorities are trying to battle here in Victoria is vaccine hesitancy, that people currently over the age of 50, those people who are eligible, just aren't taking up that offer for the free vaccine. And that's now encouraged a push from people in Victoria as well, the state government itself, for the federal government to expand the eligibility of the vaccine so that more people who actually do want to be vaccinated can do so if they'd like to. So it'll be interesting to watch the numbers in particularly today to see whether or not there has been a continued increase in the number of people getting vaccinated.
We're all waiting anxiously for those numbers, if there are any, of course. Leanne, thank you. Meanwhile, South Australia has slammed its borders shut to Greater Melbourne and Bendigo. Essential travellers and residents can still enter, but will have to quarantine for 2 weeks. The NT has declared Melbourne and Bendigo hotspots, requiring visitors to quarantine in government facilities. Border passes are now compulsory for Victorians travelling to Queensland, and Tasmania and the ACT have closed their borders to anyone who has visited an exposure site. The Northern Territory's vaccine rollout is gaining pace among the younger community. The NT government says it has fully vaccinated more than 10,000 people, and 1 in 6 people have received their first dose. Anyone over the age of 16 is now eligible for the vaccine if they live outside Greater Darwin.
The young people protecting the whole of the community, the older people, the elders and other members of the community. It's a good thing for the community, for the young people to be able to have access to the vaccine.
US President Joe Biden has asked the intelligence community to redouble its efforts to investigate the origins of the COVID-19 pandemic. In a statement, Mr Biden says there is insufficient evidence to conclude whether the virus emerged from human contact with an infected animal or from a lab. He's directed US national laboratories to assist with the investigation, and he's called on China to cooperate with international probes.
We will continue to press China to participate in a full, transparent, evidence-based international investigation with the needed access to get to the bottom of a virus that's taken more than 3 million lives across the globe.
In the UK, Boris Johnson's former top advisor says the government fell disastrously short in its pandemic response. Dominic Cummings has told MPs that thousands of people died needlessly as a result of government mistakes. Mr Cummings says that in February last year, the Prime Minister regarded coronavirus as a scare story and even suggested he would get himself injected with the virus to prove so. Mr Johnson has defended his government's actions.
To deal with a pandemic on this scale has been appallingly difficult, and we've at every stage tried to minimise loss of life, to save lives, to protect the NHS, and we have followed the best scientific advice that we can, Mr Speaker.
Epidemiologist and head of the Melbourne School of Population and Global Health, Professor Nancy Baxter, joins us now. Nancy, good morning to you.
That's certainly an anxious morning.
Yes. If you had to call it, where do you see this going today, simply based on the growing number of exposure sites?
Well, I think in addition to the growing number, it's the type of exposure sites. So what we're seeing is the very highest risk exposure sites where we know that super spreading events have happened elsewhere. So you have people who've spent several hours in gyms. You have clubs. So, when you think about the airflow in clubs and the ability of an airborne virus to spread, they're crowded. They tend not to have great ventilation, and people are speaking loudly because they're speaking over music. And so it's very high risk setting for spread to have occurred. The other thing is that once it gets beyond a relatively small number of cases, the contact tracers are doing a great job, but there's only so much they can do and only so quickly. So if you really want to get control over a growing epidemic, you do need to use measures such as restrictions and lockdowns to actually get things under control so you can let the contact tracers have time to actually do their work.
And based on the facts that, as you say, the exposure sites now include nightclubs, they now include the 2 major football stadiums in Melbourne, would you think a brief lockdown is more likely than not as we head into this morning?
Well, people worry about the footy games, and I'm not unworried about the footy games, but I'm way more worried about the workout facilities, the gyms and the clubs and the in-person dining. Remember, over Christmas it was the Thai restaurant that was the challenging spot, and that was somebody had lunch there, and what people from 3 tables got COVID. So it's that poor ventilation, that long time spent in a setting, and a lot of talking, and it's indoor, whereas the footy's all outdoor. So I know a lot of people focus on that because a lot of people are potentially exposed, but I'm way more worried about the clubs and restaurants at this point. And I would have to say, given how contagious this particular virus is, if you think about what happened in Adelaide, so they talked yesterday about what happened in Adelaide. So they think that this transmission happened because the person with COVID opened their door to get their lunch, and then a few minutes later, the person next door to them opened their door to get their lunch. And so the COVID virus particles traveled in the air out of the one person's room into the corridor, and then traveled from the corridor into the person in Melbourne's room. That's all it took. So imagine sitting in a club, talking to somebody for 2 hours, talking over music in a poorly ventilated space, how many people are potentially infected from that. So I think likely what's going to happen is there are going to be more restrictions, and I think it's likely going to be a lockdown. They're talking about a short lockdown, 3 days, and I hate to be the bringer of bad news, but I actually think this one might be longer.
Right. Without wanting to alarm our viewers too much, but how much longer? 5 days? Or as you say, given how much this particular variant of the virus circulates, are you talking a longer one?
There were people that were circulating with COVID for over a week before they were identified. And they were obviously highly infectious. They've infected, we know that they've infected a fair number of people. So we don't know out there may be a lot of people that are infected and just haven't shown symptoms yet, or shown severe enough symptoms to be identified. So I think a lot will depend on what they find in the next few days, but this could be as long as a week to 2 weeks.
Okay, let's talk about the airborne nature of this virus and go back to that hotel in Adelaide. All this started yet again as a result of a leak from hotel quarantine. In your view, does this increase the pressure on the federal government to fast-track moves to build more purpose-built facilities, outdoor cabins like the one we are seeing operating very successfully in Howard Springs in the Northern Territory?
I got to tell you, I don't know for the life of me why we're not doing that. I can't think of a rationale for not trying to improve quarantine. If it's the money, how much money is it going to cost to shut down Melbourne for a week? This can't be about the money. It can't be thinking that this is going to be over in 6 months or 9 months, so all we need to do is to ride it out. Quarantine is going to be with us for a long period of time because there are going to be these variants that continue to develop. Vaccines are not 100% effective, so we have to protect ourselves from virus coming into the country even after people are vaccinated. So quarantine is here to stay for a considerable length of time. So just get on it and build the facilities that we need. The hotel quarantine that we have may be fine for people that we think are low risk. So not from countries where the epidemic is widespread, not for people who perhaps have already been vaccinated. They may work fine for that, but they're not built to control highly transmissible airborne viruses. They're not built for that. They're built for tourists. So I don't know why you have a budget that covers all sorts of things and didn't cover what's one of the most imminent threats to the entire country right now and is very expensive in terms of the risk to the community.
Pretty valid question. We'll leave it there. Nancy Baxter, thank you.
Thank you.
Well, let's turn to the interstate reaction to the COVID cluster in Melbourne. South Australia has already introduced a hard border as of yesterday evening, and health authorities in New South Wales are worried about a new exposure site in the state's south. Reporter Charles Brice joins us from Adelaide Airport, and Nick Hose is in Sydney. Hello to both of you. Well, Charles, SA has been pretty quick to respond to this growing outbreak in Melbourne, so what are they telling travellers?
Well, Lisa, the advice to travellers is that anyone who is in the Greater Melbourne region who is wanting to enter South Australia will have to do so once the borders reopen. South Australia was the first state to shut its border to the Greater Melbourne region and did so rather quickly. People were only given a few hours' notice before those closures came into effect at 6 p.m. last night. South Australian residents and essential workers are the only people that are allowed to enter into South Australia now, but when they do so, they will have to undergo 14 days of quarantine. There are also further requirements for those who have been in Melbourne from May 20. They will have to undergo tests on days 1, 5 and 13. They'll have to self-isolate only until they get their first negative result. People who have also visited Bendigo will also need to be tested. Again, they won't need to quarantine for 14 days, only self-isolate until that first negative test. Premier Stephen Marshall said that outbreaks should be taken very seriously, but is optimistic on Victoria's response. Here's what he had to say.
Our thoughts are with everybody in Victoria at the moment, particularly those in Melbourne. Any outbreak in Australia is something that we need to take extraordinarily seriously at the moment. Australia is doing extraordinarily well in tackling the coronavirus compared to just about any jurisdiction in the world, and so we've got to work together to make sure that we don't have further outbreaks.
So many questions still about all of this. Nick, what do we know about the case who visited regional New South Wales?
Yeah, good morning, Lisa. So contact tracers in New South Wales are urgently trying to get in touch with anyone who is in Tullibuk over the weekend, particularly if you were there on Saturday at the sports club between midday and 5 o'clock. And that's because a man from Victoria who was since tested positive to COVID-19 went there on Saturday and watched a number of netball games. Health authorities are advising anyone who was there during that time to self-isolate. And of course, we keep hearing it, but it's true, if you have even the mildest of symptoms, to go and get tested. And New South Wales health authorities are actually stepping up testing in Tullibuk over the next couple of days so that residents there can go and get a swab. Just to give you a bit of context, it's a small border town between New South Wales and Victoria with a population of less than 500 people, and no doubt the residents there will be on alert, watching to see if any cases emerge from this COVID-19 person who was there on the weekend. New South Wales Health Minister Brad Hazzard has said, look, if you're in New South Wales and you're thinking of travelling to Greater Melbourne or Bendigo, maybe now's not the best time. Maybe, think about going in a couple of weeks and sort of putting off that travel unless it is essential. And he's also not ruled out introducing restrictions on Victorians coming into New South Wales. And of course, all of that will depend on your numbers today. So we'll all be watching those numbers very closely, Lisa.
Yes, all right, Nick and Charles, thanks for the update.